So hello everyone, today we are going to talk about pericardial friction rub. It's an important finding to be remembered in your clinical examination. So pericardial friction rub is nothing but it is defined as it is an actually hallmark of pericardial inflammation. So beside the heart, there are two layers that is called as parietal pericardium and visceral pericardium. And when this two pericardium layer comes together and rub against each other, the sound which is produced is called as the pericardial rub. So there needs to be some amount of fluid or something, so which creates this friction or sound, and that is so basically it's an indirect marker of pericardial effusion. So it can be either uniphasic. There are three phases it can be defined as, that is monophasic or biphasic or triphasic. So monophasic is defined as, that means during which phase of cardiac cycle it is occurring. So based on that, it is defined as monophasic, biphasic, and triphasic. Monophasic, it means that it occurs during the ventricular systole. So the only phase which is there is the ventricular systole times, when both pericardium, that is parietal and visceral pericardium, rubs against each other and creates the pericardial rub. Biphasic is ventricular systole plus atrial systole. So that is atrial systole is nothing but during the diastolic phase when the atrium is contracting, that phase is called as atrial systole, and that is called biphasic. And triphasic means ventricular systolic phase plus atrial systolic phase plus early rapid filling. So during the early phase of the rapid filling, that means when suppose this is this atria and this is the valve. So suddenly whenever the valve opens during the diastolic phase, when there were this tricuspid or bicuspid valve open, so when this open, there is early rapid filling phase, and because of that, there is a distension of the ventricle, and both pericardium can rub against each other, and it is called triphasic. So the most common is ventricular systole, followed by atrial systole, and early rapid filling phase is quite rare. So usually the most commonly seen is the biphasic one. That means both ventricular systole and atrial systolic rubs are usually heard in them. So biphasic is also called as what is called as to and fro rub. And this sound is best heard over second and third left intercostal space, as you can see here. During the second and third left intercostal space is called as the bare area of the heart, where the pericardium is directly present and it is directly audible to the chest. So as we have already discussed, there are three components: ventricular systolic component, that is during the S1 phase, and the atrial systolic component correlates with S4, and early rapid filling, rapid ventricular filling phase is S3 phase. So triphasic rub usually occurs in less than half of the cases. So best auscultation area, as we've already discussed, left, second, and third intercostal space. How, what is the character of the sound? It is superficial or some scratchy sound. You feel like a scratch like that, and a musical sound. It is best heard with the diaphragm of the stethoscope pressed firmly against when the patient is sitting and leaning forward position. It has variable influence on the rub, often better with held inspiration. So when if the you ask for deep inspiration and you hold, and that times you can actually hear this part more. And it is very transient. It can be rub can be evanescent and disappears within hours. So sometimes you may hear it, sometimes you may not be hear it, and the positions also may vary a little bit. So this is not a fixed position. It is definitely transient. So it may be present even with large pericardial effusion and tamponade. So pleural rub, unlike pleural rub, when there is large pleural effusion, there is less chances that pleural rub will be definite unlikely to be heard. However, in large pericardial effusion, this rub can be still present even in presence of large effusion or tamponade. So coming to the etiology or diagnosis, why it comes, how you can diagnose that. Suppose a pericardial rub is present. So based on the symptoms, how can we say that patient may have which disease is? So suppose patient have a fever, chest pain with a pericardial rub, you will suspect about acute pericarditis. If patient has acute MI, that is post-MI patient or post-myocardial infarction patients, you will definitely suspect MI patient. If they have having pericardial rub, you will suspect post-MI pericarditis. Suppose patient is of known case of uremia or CKD with on dialysis or something, and that time you will suspect is uremic pericarditis. If associated elevated JVP or patient is in shock, you will suspect cardiac tamponade, and acute rheumatic fever, you will suspect rheumatic pancreatitis. So, what is the significance of pericardial friction rub after acute MI? Suppose after an acute MI, patient develops pericardial friction rub. What does it mean? It means that first thing is, it means that there is transmural infarction. So, transmural infarction, there is always chance that this infarcted part may rupture and may lead to ventricular septal rupture or free wall rupture. So definitely in this patient, suppose the patient has a pericardial friction rub, you should not give anticoagulation to this patient, or you should not think about thrombolysis or fibrinolytic therapy in this patient. And this pericardial rub may cause persistent pain following an MI and may be responsible for sometimes for post myocardial infarction fever as well. Symptoms may relieve promptly with use of steroids. So that's all about pericardial friction rub. If you have any doubt, do comment in our comment section. Thank you.